I'm Ryland Austin, Smart Body Physical Therapy. So tonight, basically what we're going to talk about is how physical therapy or just anything in general can help after either an auto accident or some type of acute trauma, whether it's a fall or usually it's going to either be a fall, a motor vehicle accident, or it's just any type of accident that can happen where you receive an injury and you're not really sure what to do about it. So what happens after an acute injury or a motor vehicle accident? So usually what happens after you have an injury of some type, you have three types of ways of describing the injury. Typically you're going to have some type of physical damage, sometimes a neurological injury, and most of the times there'll be a lot of psychological aspect to the injury as well. When we talk about physical injury, we're essentially looking at either ligaments, muscles, tendons. You can even put bone in there. You know, did you break a bone? Did you tear a muscle? Are the muscles guarding? You know, what happened physically to you in the accident? When we talk neurologically, we're getting more into the nerves aspect. So did you have a herniated disc? Or do you have some type of nerve impingement, you know, in the shoulder, in the neck, stenosis maybe? Or, you know, are you having either some brain problems? Did you receive a concussion? Or sometimes even whiplash can have some neurological symptoms to it. So that's what we're talking about when we look at the neurological aspect. And then psychologically, you know, what did this accident do in terms of stopping you from living your normal life? You know, a lot of times when you get a lot of pain, you become scared of the pain, right? You don't want to move. You just want to lay around. You think that if you just rest, the pain will go away. So then you're scared to move because every time you move, the pain goes up, right? So then why would you want to move and make the pain worse? So that's what we call fear of movement. And that actually is probably one of the biggest problems. The other thing is a lot of times depression can kick in as well because either A, you know, you had just started working out, you were going to the gym, you had just lost 20 pounds, you got in a car accident and you just gained all 20 pounds back. So now you're depressed, you know, you're not thinking you're ever going to get back to being healthy and being able to go to the gym again and get healthy with everything that you were trying to do before. Or, you know, maybe you hadn't thought about doing that yet, but now that you've gotten in the car accident or now that you've had this, you know, low back injury or neck injury or shoulder injury, now you're thinking you're never going to be able to do that in the future. Maybe you were in the planning phase. Maybe you thought eventually you would get to that point. Now you're kind of depressed because you feel like that's never going to happen. So we'll address that a little bit. So first, let's talk about some physical injuries. When it comes to motor vehicle accident, you know, the most common injuries are going to be whiplash, low back pain, and concussion. Obviously, there is a vast list of injuries that can happen, from broken bones to all types of other things. But these are kind of three of the most common that typically happen even if the car accident isn't that serious. You're going to have some type of form of one of those three. Some other common injuries outside of the motor vehicle aspect are usually going to be some type of rotator cuff issue. Either you were falling, you stuck your arm out, and now your shoulder's hurting. Or you were slipped, you fell on your back. Or you were out doing something, you were out, you know, in the store and something was slippery, you know, going from tile to carpet, you slipped, you hit your head. You know, these are usually typical injuries that can occur that, you know, kind of scare us in a way. They're very serious, but maybe not as serious as we make them out to be. And by making them so serious mentally, we kind of exacerbate the symptoms or make them worse than they need to be. And so sometimes just having good knowledge and receiving the right medical care can really help you to get back onto the healthy track without having to have so many questions. And so just to address some of the myths, these are a couple myths, especially with car accidents. One of the big ones is, you know, I got in a car accident, my car was fine, no damage to my car, I'm doing good, maybe a small little dent in my bumper, I'm not hurt. There's no way I could be hurt if my car's not hurt. You know, and this is definitely not always the case at all, especially since most of the time, with the second point, pain doesn't always start right after an accident. Especially with motor vehicle accidents, the pain can actually come on, you know, 2 weeks later is very common. Or most of the pain will come on 2 weeks later, a week to 2 weeks later. And so it's important that you receive, the medical attention at that time when it's available to you, rather than waiting. Or if, let's say you had a slip and a fall. You slipped, you fell, you hit your head. Well, yeah, I've been having a few more headaches, but they'll go away. I'm sure I'll be fine. But then you go a couple days without doing anything, you may have received a concussion, have some internal bleeding, and things just get out of control. Whereas if we catch it at the beginning, then usually you can kind of nip it in the bud. One of the third myths is that if I just rest, say take some Motrin, Advil, ibuprofen, I'll be fine. It'll go away. I'll probably be able to just get over it. This is where I fall into that category. That's me all the time. Every time I get hurt, I'll just rest, put a little ice on it, a little Motrin, I'll be fine. But really this is probably one of the worst things to do, because what we end up doing is we end up starting to live our life with these injuries, and now we create compensations. And the more compensations we create, either the worse the original injury gets, or we start to create new injuries. And so now instead of having maybe one minor to moderate injury, now we've got 5 moderate injuries that we have to deal with. And we can't fix one until we fix another one, until we fix another one. And it becomes a little cycle that we kind of have to go through. So moving on to neurological injuries. A lot of times with these type of injuries, so we're talking about herniated disc or impinged nerves or stenosis or things like that, concussions even, a lot of times the symptoms, so where you're feeling the pain, is not always where the pain's coming from. So a lot of times, and I don't know if you can see this picture, but there's a little X on the neck there, and then there's some red dots down the arm. And these were studies done. And so the X is the actual spot where the origin of the pain is coming from. The red dots are where the patients have described feeling their pain. So you can see around the X, or maybe you can't see, but I'll describe it. Around the X, there's not very many red dots. A few of them, not too many. Most of the red dots are actually down the arm, either in the hand or onto the side of the arm. And this is just one example of one spot. They're all over the body. So this is what we call referred pain. So referred pain can be very deceiving. And this happens a lot with usually herniated disc. So you hear people get herniated disc in their low back, and then they talk about how their foot burns or the back of their leg burns or hurts. And they don't understand why people are talking about them having back problems. I don't have back problems, it's my foot that hurts. This happened with my father. He hurt one of his discs, ruptured a disc, and he was having really bad calf pain, a lot of burning. And they started doing back tests, and he was getting very frustrated. He felt like they weren't listening to him, that they didn't, that they weren't really understanding what he was trying to tell them. And then eventually, once all the imaging and stuff came back, he realized that the pain was coming from the back once they did the nerve study. So that's one kind of tricky aspect of nerve injuries. The other real tricky thing with nerve injuries is not that they're unpredictable, but the healing times can be a little bit off. So sometimes nerves can be the quickest thing to heal, and sometimes that can also be the slowest thing to heal. It depends on the severity of the nerve injury, and a lot of times it depends on the location of the nerve injury. So either where is it being impinged, or how serious is the disc herniation. So that's one of the more frustrating things with neurological injuries, is that the healing tends to be a little helter-skelter. And psychologically. All right, so the big thing here is fear of movement. So fear of movement can, in the long run, end up being more debilitating than actually your physical injury itself. So if you're hurting, so down here, this little flow sheet here, if you have pain, then you have fear of pain. If you have fear of pain, then you're going to avoid doing activity. If you avoid doing activity, you might as well be disabled. Okay? And this is so true, because what's happening is when we are scared to move, then we are telling our body to be guarded, or keep ourselves from hurting more. So therefore the muscles and everything else stay tight. They don't relax. When muscles stay tight like that, they don't allow proper blood flow throughout our body. When we don't get proper blood flow, we don't get proper healing. So that's just kind of like a little snowball effect of fear of movement. So moving is actually sometimes one of the best things to do when you're hurting. Exactly. So, getting in a pool, walking around in a pool, doing some exercises, or just even getting up once an hour and walking for 5 minutes. you know, just to get off the couch, get out of the bed, get some fresh air, go outside, see the sun, you know, things like that. Those are things that aren't going to help you physically as much as they're going to help you mentally. You know, get you out into the real world again. Depression, we talked about that a little bit, is another one of the things. So having a setback, you know, you were, like I said, going to the gym, you were doing good, lost all that weight, boom, you get hurt, all the weight comes back. You know, and what you have to try to realize is you can't get depressed over it. This is just a minor setback. You know, this is just another hurdle in life that now we're going to have to get over. You know, they're going to keep coming, they don't stop. And so, you know, it's understanding that this isn't the end of the world. Chances are, as long as you're breathing, sitting up and taking fluids, as one of the patients once said. He said, as long as I can sit up and take fluids, then what do I have to be depressed about? And, you know, and that's a great way to look at it, you know, that you are going to continue to get better, and as long as you continue to try to get better, then there's nothing to be depressed about. Go for it.
People tend to use the word depression too loosely in my mind. Sometimes it's just simple disappointment. And it's not depression, it's just disappointment. Disappointment.
Right.
Am I right there?
Absolutely. What happens is people get disappointed, right? So they got hurt, they were being active, you know, you were at the bowling league or something like that. And then you get hurt, so you're disappointed. Now you can't do bowling, you can't go do the exercises you were doing before. So then what happens? You start to stay home more, right? You don't go out to the community as much. You don't go to the store anymore. You tend to just sit in your recliner and watch all your TV shows all day long. You sleep 15 hours a day now. You know, do things like that. Over time, that can lead to depression. So disappointment, absolutely. That's what kind of starts it off. You're very disappointed in everything that's going on. As that kind of snowballs, you can get towards depression. Exactly. Yep. Exactly. So that kind of leads to the idea that, you know, what happened to you is the worst thing that's ever happened to anybody. This has never happened to anybody before. I'm the only person this has ever happened to. And, you know, a lot of us, everybody always thinks like that. We all do. I'm the same way. You know, oh, this has definitely never happened to anybody before. I'm definitely the first person this has happened to. And, you know, part of that is sort of, what's the word I'm looking for, is denial in a way. You're denying the fact that you can be helped. You don't want help because I'm helpless. There's no way somebody can help me. This is the end. And, you know, we have to accept help. You know, when it comes to our health, nobody knows all there is to know about health. New research is coming out so fast that we can't keep up with it. And so accepting help and accepting knowledge on your health is the best thing you can do. That's the best way to keep yourself getting better and continuing to move forward. The other fear, fear of returning to full activity or reintegration back into the community. So talking about the disappointment thing. So disappointment rolling into depression. You know, then once you get depressed, you know, you don't want to go out and see your friends anymore. What's the point? I can't go bowling with them. I can't go walk around. You know, I can't go to the stamp collection, you know, meetings and things like that. So why would I go outside? Why would I go meet with these people if I can't go do those things? And that's exactly the mindset that we don't want. We want you to go out in your community, you know, receive help from your friends. So that way you can go to the stamp collection. You can go bowling eventually, kind of get you back into it. You can still go to the bowling alley. Maybe you can't bowl with them, but at least go there, be with them. So that way mentally you're not going to lose all of that input. All right, so why can physical therapy help? So not only can physical therapy help you after a motor vehicle accident, so kind of talking about that, as well as acute injury. All right. So why is PT so great? Lots of things are great for this. I'm not saying that PT is the only thing that works, but PT, obviously being what I do, I think is wonderful and does a lot for you. So one of the most important things after getting, you know, an injury is getting rid of the pain. Pain is what you will deal with up front the most, and in the long run, you'll still be dealing with it towards the end. So at the front and at the end, these are probably the two things we deal with the most. So at first, what are some things that we can do to make it feel better? Well, with physical therapy, we use a lot of passive treatments at first. So what are passive treatments? It's ice, heat, ultrasound, gentle massage, you know, electrical stimulation, using a TENS unit. things like that, things that decrease your pain level. If you're in a lot of pain, we get that fear of movement. Fear of movement, we already talked about, leads to disability. So we want to get you out of that pain and out of that fear as quickly as possible before your disappointment turns into depression, right? So we want to go ahead and get rid of that. So the first thing we're going to do is try to decrease your pain. So physical therapy, once we get that pain down, is going to help you get back to moving again, get you back into the community, get you back to doing exercises, getting you back to being active. And the way that we help do that is we get you doing that the right way and the safe way. So we don't want you to, just go and jump back to the gym and start doing what you were doing before the car accident, or before you hurt your back, or before you hit your head, or anything like that. Because chances are you could flare it back up, and now you're right back at step one all over again. Now we're doing ice and heat and ultrasound, trying to get you back to having no pain again. So what we do is we help modify the things that you were doing before, okay? We help you come up with activities that maybe you didn't realize you enjoyed that aren't going to hurt you as much. The other thing is motion is lotion. So the more you move, the looser you'll be. Motion is lotion, especially for our joints. The more you move your joints, the more fluid they get in them, and the more loose they stay. Less likely you'll have arthritis, less likely you'll have cartilage wear down, and less likely you'll have pain. So motion is lotion. If you remember nothing else tonight, motion is lotion. So next thing we're going to do is we're going to do active treatments. So by active treatments, we basically mean doing exercises. And I'll talk a little bit more about exercises as we go on. But getting you back into doing stabilization exercises, strengthening exercises. Because you probably haven't been as active as you were for the last month and a half, 2 months. So you're going to lose a little muscle tone, lose a little bit of your endurance. You're going to fatigue a little quicker. So we'll get you back to doing some exercises to kind of get you back to getting strong again. And then, can't say it enough, fear movement avoidance. If you come to PT, we're going to make you move. And if you move, you're going to end up feeling better. You might be sore, but you're going to end up feeling better. And we're going to get you moving again, okay? A couple of really important things is restoring proper posture and getting your body mechanics back, okay? So, if you're in pain, chances are you're not going to be able to hold good posture. You're going to be crouched over a lot, you're in pain. So if your back hurts, you don't want to move. If your neck hurts, you're going to be doing this a lot. If you hurt your shoulder, you're not going to be able to hold your shoulder up and stand up nice and tall. You're going to hold it over in front of you like this a lot. And what that does is that creates compensations. And as you create compensations, you create new injuries. The other thing is we want to prevent any expansion or growth of scar tissue. So if you had trauma to your body, chances are your body laid down scar tissue. Scar tissue is our body's way of preventing things that are torn or possibly about to tear from completely tearing and ripping wide open. And so our body will lay that scar tissue down until it no longer has a fear of there being an injury in the area. And, until the body starts to feel better, it can continue to lay the scar tissue down. And so what we want to do is we want to get you moving, get rid of that scar tissue. The other thing is prevent future injury. So usually once you've had an injury, such as, a low back injury, a neck injury, a shoulder injury, you are at a much higher risk of hurting that same body part again. That can happen again. Low back pain especially, if you don't do the proper stabilization, core exercises to get that stability back, chances are in the future you could be doing nothing more than bending down to pick up a shoe. You could hurt your back all over again. So what we, physical therapy, help you do is to not only restore your health and wellness now, but to help you feel better and prevent you from ever coming back to see us in the future as much as we possibly can. So what are some common symptoms? So this is very general, just talking about in general with acute injuries, things that you would expect. So when it comes to this, tenderness to the touch, this is talking about, when your muscles are going to be very active, your pain fibers are very active, excuse me, your pain fibers are going to be most active. So just even somebody touching you, or sometimes even just your clothes touching you, hurts. Everything hurts, and you can kind of expect, that doesn't mean that you're wrong or something's wrong with you. That's pretty normal. The other thing is pain, more pain, right? We talked about that. Numbness and tingling, so getting onto the neurological side, if any nerves or discs are involved, tingling in the feet, tingling in the fingers, things like that. That usually means that we've got some type of nerve issue that we're dealing with. Tight muscles, and I put in parentheses there, guarding. So this kind of goes along a little bit with that tenderness to touch. If those muscles stay tight and they stay guarding, they're going to decrease blood flow. As that blood flow stays decreased, then the muscles just get more and more aggravated. All right. So I always like to use the analogy of the sponge. So you have your sponge, right? Think of your muscles as being a sponge. If your muscles or your sponge are tight, so you squeeze the sponge and you run it under water, it doesn't soak up any water, right? It stays nice and tight, and for the most part, it's going to stay dry. That's your muscles when they're tight. They don't suck up any blood flow. They just stay nice and dry. What we have to do is we have to relax the muscles or get them to kind of open back up to let the blood flow get back in. That way the sponge can soak up the water. Once they soak that water up, soak that blood up, then usually they calm down. They're not going to be as irritated. They're not going to be as tender. Difficulty sleeping or finding a comfortable position. This is something that a lot of people will deal with. And this is one thing that I'll talk a little bit more when we move on. This is one thing that can last usually for a little while. This is one of the common things that most patients will complain about, is just not being able to get comfortable. And that's something that you kind of have to trial and error and work with. There's certain positions that we know to be better, but that doesn't mean that they're always best for everybody. Headaches, especially anything involved in the neck or head, headaches, dizziness, and blurred vision as well. All right, how to decrease your symptoms. So these are just a few of the things that, especially right off the bat, the next day, that first week, these are some of the things that we want to focus a lot of our attention on. First thing, ice and heat. We always get the question, which one do I use? Do I use ice? Do I use heat? Which one's better? They're both good, okay? They're both good. They both have pros. They both have cons. Typically, you're going to want to use ice first when it's acute. First week, first day, things like that. Ice is typically what we're going to want to use. Ice is going to help to reduce inflammation because ice reduces blood flow, right? So if you put ice on what's hurting, you're going to decrease the blood flow to the area, which is going to decrease the body's ability to create inflammation in that area. Inflammation is what makes us tender and sore and painful. So if we can decrease the amount of traffic in the area bringing inflammation, then hopefully we'll have less pain. But as you start to get out of that stage, it becomes important that you kind of use heat as well. Because if we're using too much ice or using ice for too long, then now we've restricted the amount of blood flow to the area that we want to heal. How do we heal? We heal with blood flow. Blood flow brings oxygen. Blood flow brings nutrients. Without those two things, we're not healing. Nothing's going to happen. You're just going to stay hurting. So if you ice for too long or ice too much, you're going to actually have the reverse effect of what you want. But right at first, the first week, first 2 weeks even, sometimes even longer than that, depending on how much pain you really are in, ice is probably the best thing to use. It's also going to numb the pain. So it's going to slow those pain fibers down. They're not going to be as sharp. They're not going to be as quick. So the pain kind of gets dulled a little bit. You put that in combination with the TENS unit, and usually we can at least knock out the pain for a little bit so you can get comfortable. So heat. So I talked a little bit about how it reduces blood flow with ice. Heat obviously does the exact opposite. You're going to increase your blood flow. So it's going to bring in those nutrients, bring in that oxygen to the tissues, increase your healing capability. So this is something that we use sort of later on when the injury becomes more settled and kind of getting into more of a stage where your pain's pretty much leveled off. It's not really going up, not really going down. You're kind of dealing with it. This is when we want to start to kind of use heat to allow you to get those nutrients into the area. It also helps to loosen up the muscles. So we talked about that, the sponge. If you put heat on, heat's going to bring blood flow. That blood flow hopefully will get soaked up by the muscles, allowing the muscles to relax. But I always tell people, use both. When you get to that stage, use both. Which one feels better, you roll with that one. There's no right or wrong way. Like I said, both have pros, both have cons. So you use both of them, whichever one works, you use it. If they both work, do 10 minutes of one, 10 minutes of the other one. That way you're getting both pros, both cons, kind of cancel each other out, and you're going to get a little bit of pain relief and a little bit of healing at the same time. Not as much as if you only did one, but you get a little bit of both of them. So the TENS unit. So these are very typical for people to take home. And what it is it's electrical stimulation. And what these units do is they're basically, we call it the gate theory is one of the theories. There's a couple theories out there. Gate theory is probably the easiest one to explain. Basically what you're doing is the nerves, your pain fibers, all travel using neural signals, using electricity. And so what happens is we use these TENS unit to stimulate your sensation. So that tingling feeling you get when you put the TENS unit on, that's stimulating you. You're getting that sensation. So as if you were rubbing your arm. So no different than if you bump into something and you kind of rub your arm. It doesn't make the pain go away, but it feels a little better, right? So it's the same type of idea. By stimulating your sensation, which is actually faster than your pain fibers, it can get through the gate first and take up more room going up to the brain. So that way the pain fiber isn't as strong. It can't put as strong of a sensation into your brain. So therefore it feels a little bit better. It makes it dull. It dulls it down some. And so this can help. And with TENS units, you can wear these pretty much almost as long as you want. There's not really a time limit on them. You can wear them for quite a while. Some people wear them all day. But especially you wear them at times of pain. So if it hurts when you sit down at work, you wear it when you sit down at work. That's going to help you keep the pain down. If you keep your pain down, then you'll keep the muscles from getting tight. Keep the muscles from getting tight, you can allow healing to continue. So you can see how everything kind of becomes connected. And so the more things we can do to keep pain down and keep you feeling good, keep you wanting to move, then the quicker we'll be able to heal. Proper positioning. So this is what I was kind of talking about with the sleeping or getting comfortable. So one of the best positions is what we call the 90-90 position. So that's the picture here. And basically what you're doing, this is typically for low back pain. With neck pain, you basically just want to keep the neck in neutral. So you want to get a nice firm pillow. You don't want a pillow that's too soft. A lot of times we'll just cut the pillow out completely. And you can get a little roll, you put it in the little kink behind your neck, and it just keeps your head nice and still. Nothing's really going to cause it to move or anything like that. But with the back, one of the best positions is this 90-90 position. What this 90-90 position does is it takes a lot of the pressure off of your low back area. So you can use either a chair, like the woman's using here in the picture. Couch pillows are usually really good because they're really big and fluffy, and you usually just throw them on the floor when you sit on your couch anyways. Or you can use pretty much anything you want. But being in that 90-90 position a lot of times can help to relieve the tension in your low back and help you to kind of get comfortable. And you may not be able to sleep in this position, but you may at least be able to start falling asleep in this position. And then you can get it comfortable enough to where you can go into your normal position afterwards. The next thing, pain relief gel. This is something that it's very superficial in the sense that it's not going to give you any long-term relief. It's not going to heal anything. It's not going to perform any magic. But pain relief gel, so BioFreeze, Tiger Balm, Icy Hot, the concoction that your grandpa made up when he put these two things together, these type of things can help though, because they are going to stimulate the sensation. So same thing like what the TENS unit's doing. Not quite as strong as the TENS unit, but pain relief gel, at least, you don't have to carry around a machine or whatever. It's a little more accessible. So, rubbing BioFreeze on the area that hurts, you're now stimulating your sensation, so the pain's being dulled. The only problem usually with the pain relief gels is they have a very strong smell to them, and everybody can smell you coming. All right, the next thing is gentle massage. All right, so gentle massage. So especially like the first week, 2 weeks after an injury, you don't want anything too deep or too heavy on those muscles. The muscles are guarding, so those muscles are tight. They're not going to need a lot of pressure on them to react and get sore. So if you go, the week after a car accident and you get a deep tissue massage, you may not be able to get out of bed the next morning because your muscles are going to be not liking you at all. And so it's important to get only gentle massages. Even just somebody rubbing your back with their hand is usually about all you're going to be able to take. And that's not necessarily a bad thing, because with that sensation of the hand rubbing on you, you're getting increased blood flow to the area and you're loosening up the muscle a little bit, okay? So gentle massage can help a lot. The other thing, staying mobile. So we talked about fear avoidance, keep coming back to that just about on every slide. Being as mobile as possible. It is important that you don't get too stiff, all right? So I'm gonna keep saying that, probably almost on every slide we're gonna talk about that. So what are good exercises? So you're starting to feel a little bit better. You're out of that pain stage for the most part. Obviously, we're still dealing with pain, but people can touch you now without you backhanding them because it hurts too bad. All right. So what are good exercises to do? A lot of times, very popular question is, should I do the treadmill, the elliptical, the stair stepper, the bike? What should I get on as far as if you're going to do some type of cardio? And it's a great question because it really depends. This is really the best answer I can give you. If you have hurt your back or your neck or anything like that, usually we're going to avoid the treadmill. We're going to avoid walking. We're going to avoid running. We're going to avoid things that cause a lot of impact on the body, because that's going to just send vibrations up the body and cause everything to usually get tight again. Walking in the pool, however, is perfect. You're decreasing all that weight bearing. Usually you're not getting as many forces brought back up through the body, and usually the water's nice and warm, especially down here in Florida, all right? So that water's gonna be nice and warm. It's gonna help relax you a little bit. So walking in the pool, though, is great. Treadmill, bad. Walking in the pool, good. All right, the bike. When it comes to the bike, the recumbent bike, or the one where you're kind of sitting back in and you're kind of relaxing and you're strolling through the park, that one is perfect. You're not putting a lot of pressure in your back, and usually you're gonna be able to do quite a bit on there without having any pain. The sit-up bike, so your normal bike, where you're kind of sitting up nice and tall and you're leaning over and holding the handlebars, usually that's gonna be a bad one. You're gonna be in kind of a position, once again, where you're putting a lot of pressure in your low back area. So you're usually gonna wanna avoid that. Stepper, elliptical type of machines, I actually don't mind these at all. One stipulation is that I don't like to use the arm part of the elliptical at first when we're getting you back to moving again. Because the arm part, you're getting into a twisting motion. And sometimes the back, neck, things like that, they don't like that twisting motion. So I'll tell you just to hold on to the sides and just do the feet part. And that's fine, because that's not impact. Your feet aren't coming up and coming down. They're staying on the pedals the whole time. All right, what are some good exercises? So once that pain and tissue activity's kind of gone down, it's important that we emphasize using stability exercises. So getting your core strong again, getting your neck muscles strong again, getting your hips strong again, getting your knees strong again. Basically decreasing the chance of one of your body parts, especially in the area where you were hurt before, kind of giving out on you or failing on you. We want to increase that stability back. You haven't been using that body part for a while. Or maybe you have been using that body part, but because there's been so much inflammation, so much swelling, so much pain in that area, the muscle's probably actually atrophied and has actually gotten smaller. And so it's not able to do maybe what it was able to do before. So getting that stability back is very important. The other thing, we need exercises that are going to keep you in as neutral of a position as possible. So if you hurt your back or hurt your neck, we don't want you flexing your neck and flexing your back, doing crunches and things like that. We want you to do exercises that are going to keep you nice and flat, nice and firm. Basically, you have given that body part stability. You've given it some passive stability, so that way the muscles in the area can still work without them having to focus on actually being those stabilizers. Eventually, we can work out of these neutral positions, but for reintegration, we want to try to keep you in as neutral as possible. The other thing is knowing when you're doing something that's too hard. So if you can't breathe out loud, or if you can't talk while you're doing the exercise, you're probably doing something too hard. Okay? You're having to strain too much. You're not being able to focus on using the right mechanics as much as you need to be. The other thing is having proper progressions. So not going too fast. We know everybody wants to get back into that gym to lose those 20 pounds that they had lost before. We know that you want to get back to your stamp collections and things like that. But not going too fast, taking the right road. You may be able to get back to the gym and you may be able to lose 10 pounds, but then all of a sudden you went too hard and then now you're hurt again, and then now you just gained 30 pounds back, So we want to get you to work your way up there, but work it the right way. So these are just a couple of quick exercises that we really emphasize. So abdominal bracing, we call it the zipper. So putting your zipper on. Basically, your abs and your core muscles make up a corset. So when you have that corset tight, and if you tighten that corset up, it's going to increase the stability in your back area. And this cannot be overstated how important that is. Even if it's a shoulder injury, you want to have a strong core, because stability comes from your core area. So without having a strong zipper, you're already off on the wrong foot. Pelvic tilts, these are very important because these are going to help to kind of start to work your spine back towards getting back into that neutral position. So a lot of times if the back muscles are really tight, if they're hurting a lot, you're going to go into that bad posture, bad body mechanics. You're going to lose your normal positioning in your spine. So pelvic tilts will help to kind of get that back. When it comes to the neck, it's very important that we work those neck flexors, so the muscles in the front of the neck. A lot of times the muscles in the back of the neck are what's going to get tight. They're going to get really tight and they're going to kind of pull your head down like this. So we got to get the muscles in the front strong so it pulls your head back forward again and reintroduces your normal curve in the back of your neck. And then stretching. So low back stretches and neck stretches. Once again, this is just to keep those muscles nice and loose, keep the blood flowing, make sure your sponge is soaking up as much blood as it possibly can, essentially with that. Imaging. So I wanted to touch on this a little bit because, a lot of times people feel like their injury is not being either properly fixed or properly diagnosed without imaging. And while imaging is very important, and I wanted to make sure that we got this in here, especially after a motor vehicle accident, imaging can be one of the most important things because we talked about it earlier. Just because you don't have pain right after the car accident doesn't mean that something's not wrong or something wasn't hurt in the first place. So, after a car accident, you usually have access to medical staff. Either an ambulance was called to the scene, or you're going to see your doctor, or something like that. And you just need to make sure that you get as much care up front to rule everything out as possible. Okay? So it's very important that you at least get x-rays done. And so usually with the x-rays, they can tell whether or not they're going to move on to doing MRIs as well. But usually you're going to get both done if you have any type of neck or back pain. Or you need to at least get both done if you have any type of neck or back pain. And while that's very important, from a physical therapy standpoint, I'm going to treat you the same way. Okay? So it doesn't really matter if you've had the imaging or not. That's not the take-home message. It's not that you have to have imaging. Because whether you have a herniated disc or a pinched nerve, we're going to decrease your pain, we're going to work on increasing your stability, and we're going to work on getting you back to moving in the right, safe way. If you have a herniated disc, guess what? We're going to decrease your pain, we're going to increase your stability, and get you back to moving in the right, safe way. So in the grand scheme of things, imaging is not the be-all, take-all, but at the same time, it's very important, especially with neck pain and low back pain, that we make sure that we know what we're dealing with in case a month from now, you come in and you say, oh, my big toe has been tingling for like a week now. I'm not really sure why. So now we've got to go back through the whole process of getting the imaging done. And now you have become disappointed. Okay, and so now we're back to being disappointed again. And it's almost like we're having to start over psychologically all over again. So when we're talking about symptoms, how long is this going to last for? And so I just kind of broke this down into like 4 categories. This isn't no scientific data here or anything like that, but this is kind of basically what we see on average. So you have minor, medium, serious, and then extreme. Hopefully none of us in our lives will ever experience extreme. So when it comes to minor accidents, these typically are accidents where you probably don't even notice that you're hurt. You may have bumped something, you may have been in a car accident and the car didn't have any damage to it, or maybe you just had a little bump in the bumper or something like that. These are typically going to be minor accidents. But these are the accidents that symptoms can show up 2 weeks later. Okay, your body stops guarding and all of a sudden you realize that you actually tore a ligament and now you've lost all stability and then you have pain. Typically, these aren't going to last for much more than 3 months. You're pretty much going to get back to 100% health less than 3 months with proper, ice and rest, and then getting you back moving again in the right proper way. You're going to get back and be fine. Medium accidents, this is probably one of the most common. This is typically after, if you're in a motor vehicle accident when the car did take damage. So now you've been in a car accident and there was some damage. A bumper got torn off or a door got dented in. People did get hurt. Maybe you did go to the ER, things like that. When it comes to an acute injury, these are injuries that happen and now they're preventing you from being able to go do things that you used to do. Can't go to the bowling league anymore. Can't go play softball, can't run, can't walk. It's stopping you from doing your normal activities. These are typically what we'd call like medium level accidents. These will typically have symptoms that kick in pretty soon, either the next day, that same week, something along those lines. And most of the time, within 6 months, you're going to be pretty close to being fully healed. While you may still have symptoms, you may still have, some pain in the back, some pain in the hip, some tightness somewhere. For the most part, you're able to do most of your activities pain-free. You may still have some activities that hurt, but most of your activities aren't going to be too bad. Moving on, now we have serious accidents. And as far as serious accidents are concerned, motor vehicle-wise, usually the car is totaled. That doesn't mean that it got flipped over and landed in a ditch and now it's in like 4 pieces totaled, but there was some serious damage to the car. When it comes to acute injury, these are injuries where it may even be possible that you could have surgery to fix the problem. That doesn't mean you always have to have surgery to fix the problem, but that possibility is out there. These are what we would consider serious injuries. If something's hurt enough where a doctor says to you, I can cut you open and go in there and fix it, it's serious now. We've gotten to a serious category. And typically with these injuries, you're going to need rehab. You're going to have to work at it. It's going to have to take, activity modification. It's going to take a lot of support from family and friends and things like that. But within a year, you should really kind of be coming around back to normal. You should really start to be able to do everything you were doing before, everything you kind of want to do without having too much pain, without having too many flare-ups. Extreme accidents, this is what I was saying, hopefully nobody experiences. This typically is when you either are knocked out unconscious, you're in the hospital for weeks on end, you're having surgery, but this time you didn't get to decide if you wanted to have surgery or not. These are extreme accidents. And these a lot of times you're dealing with obviously a lot of physical damage, but a lot of times these become very emotional and psychological injuries to heal as well. And these can take years to heal and eventually hopefully get you back on track. So take home messages, we're almost out of here. Remember that no matter how much pain you're in, whether it's at the beginning of the injury, towards the end, in the middle, you can get help. All right, there's help out there. Whether it's from your doctor, physical therapist, chiropractor maybe not. These are the things that are going to help you to get back to being who you are and who you want to be. And there are people that can help you decrease your pain. Don't rely on gimmicks and things that promise immediate responses to pain. There's not a magic pill you can take that's immediately going to make your pain go away. Ask anybody who has been in a car accident or been hurt. They take their pain meds and it might help, but it doesn't take the pain away, okay? So there's not going to be, any type of magic cream that you're going to rub on and make it go away. If there is, use it if it works, all right? Don't trust that rest alone is going to allow you to heal. So we kind of talked about that. Motion is lotion. See, it was almost was on every side. So you have to get up and you have to move around. You have to actively pursue getting healed. You're not going to be able to just be able to lay on the couch and use some ice and take some Advil and think that, a week from now you're going to be fine and good to go. Go out there, get your help. We talked about all the knowledge that's out there. Go out there, learn as much as you can, increase as many tools as you can possibly get to help get yourself back. And then, visit your physician, physical therapist, or any healthcare provider, receive the guidance that you need towards taking that right step. Not only is that going to help you physically, but I think just emotionally, it gives you that peace of mind of knowing that you are on the right path towards getting pain-free. You're on the right path towards bettering, your life in a health and wellness standpoint. So I think that is one of the most important things as well. And that is all. Thank you guys for coming. Ryland, Smart Body Presentation, signing off.